Welcome to the Breast Cancer Rehabilitation and Wellness Summit. My name's Denise Stewart, and today we'll be talking about the elephant in the room. And I'm just going to prepare you. The elephant is massive and it's gorgeous, and Fran's going to talk about it. So Dr. Fran Fisher is our guest speaker today, and she's going to be talking about sexuality after cancer. Welcome, Fran.
Thank you, Denise. This is such a great pleasure and an honor to be talking to you all the way in Brisbane, from California.
So, Fran, you're a clinical sexologist and you have an absolute interest in speaking to people about their sexuality when things are just not going so right. You're going to give us a presentation. So I'm going to just let you roll with that.
So the title of this is Sexual Health After Cancer and Sexuality and Survivorship. But if it's okay with you, I'll take a minute just to tell you a little bit about myself. And you'll see in one of the slides that it's a Catholic nun. And that was me at 19. I was raised in Manchester in England and had a very strict upbringing. And at 18, I entered a Franciscan monastery. And I stayed there until I was 21, just before my 21st birthday. Excuse me. And like the good Catholic I was, I got married at 22. Because as everybody knows, in those days, if you have sex, you better have a ring on your finger and a date in the calendar, or no sex at all. And so I very rapidly did the right thing. And 5 years later, we had our 2 children. And 8 years later, we emigrated to America from Scotland and all its terrible weather. So here we are in Scotland, in California. And it turns out the only thing that my husband and I ever really fought over was sexuality. Being the good Catholic that I was, I knew how to say no. It's a hard time saying yes. So at the age of 43, when most women make major changes in their life, our children were raised, and I decided I would take a look at this topic that had been such a sore spot for us. And I went to San Francisco to the Institute for Advanced Study of Human Sexuality. And I took a master's course in human sexuality. Now, at this time, I had been an RN. I was an SRN in England, and then I challenged the boards in California. So I had been a nurse for over 25 years. And I'd had my hands in every human orifice. But when I did this weekend workshop at the Institute, it totally, completely blew my mind. I was absolutely horrified. And when I came home to my Granite Bay bubble, as my kids call it, I swore I'd never go back. I said it was a bunch of 1960s hippies making a science out of sex. How ridiculous. So anyway, he who laughs, laughs last. And for a whole month after that, I was just tormented by my own ignorance. And so I decided, if it's so bad, I have to go and learn more about it. And so I did. I went back, and after 18 months, I was invited to do a PhD. So it took me a few years longer, but at age 50, just before my 50th birthday, I graduated with a PhD in human sexuality, which was unbelievable. And it changed my life. The fact that my husband coincidentally developed Alzheimer's at the age of 51, he was diagnosed, and 61, he passed away. So instead of this amazing sexual story being one of the success of our marriage, which is really what I intended, instead of that, I ended up having a brand new career. And and the fact that my husband had Alzheimer's and that I was doing workshops in sexuality, it just happened that I was invited to do talks for the Alzheimer's Association, and then talks for cardiac patients and prostate cancer and diabetes and anything health-wise that that sexuality is involved with. I was invited to do talks, and a letter that I wrote to introduce myself to nurse navigators and doctors who organize this really says what I'm all about. Sexuality, both function and psychological aspects of sexual health, are affected in almost everyone who goes through cancer treatment. The diagnosis and treatment of cancer often results in profound changes for the patient and also for their partners. Healthcare providers rarely address these profound aspects of treatment, resulting in less than optimal outcomes when our patients return home with no tools to help them re-enter an intimate relationship. There are many ways we can help our patients work with their mind, body, and partner to address these changes so that they can enjoy healthy, rewarding intimacy after cancer treatment. This is an area of patient care which remains unaddressed to a great degree. My presentation is an interactive experience, usually with my audience. In setting the stage for a new normal, I give your patients a platform to address their own experiences and respond to those needs, make suggestions as to how to both live and thrive through them. I address how to reconnect with their bodies, since it is common for cancer patients to check out of their bodies in order to tolerate all the intrusive treatments they undergo. Connecting with their partners again, becoming a team, and learning that the survivor is strong and can be touched, and indeed needs that loving touch is a strong message. For certain side effects of chemotherapy, and especially radiation, certain tools and enhancements are especially designed to assist in maintaining or helping to reverse the atrophy and premature symptoms of menopause. Demonstrating these devices is essential to assuage the fear of pain and psychological discomfort of self-care, and replace that fear with an understanding that new health and rejuvenation may be in their own hands and not always in the hands of the medical professions. It is self-empowering, and I have been told often that my talk was the first time since their diagnosis, after a decade or more, that hope of healthy body has ever been offered. And so I usually start actually with my trusty penis, because it really gets people's attention when I say, listen up, everybody. You know, this can be a weapon of total pain and anguish, or it can be a pleasure. But this right now is what we are. We don't want this. These two things now are for a different kind of pleasure. And so, but I generally keep my penis close to hand to kind of draw people back in, and remind them that you can have fun with this and be not so afraid. And so, and I actually, in my cardiac, because people get afraid of sex and, you know, killing them, death in the saddle, I usually take penises and give them out to everybody, so it kind of gets them over their homophobia as well. But the healing power of touch is a huge topic, which I will come back to. And so in the my PowerPoint, I'll be talking about the mind and how important it is to realize that we have to respect how our minds will play tricks with us, and when we're given that diagnosis, run off in all different directions, and really bad news travels fast. So people tend to gravitate to the dark side, And one of my dreams would be that within the teams that we have at the very beginning of diagnosis in the cancer centers, along with the psychologists and the nurses and all those people, would be somebody that can address sexual issues. Because all of our patients don't come in from thriving, happy relationships. And those who are in thriving, happy relationships tend to have a terrible fear that everything will go to hell in a handbasket. And so I think addressing it right up front as an issue of like pregnancy, you're going to go through periods of, and some people have very difficult pregnancies and they don't have sex for months on end, but you teach them how to make love in different ways. And when you're young and virile, you tend to find ways to do things. But when you're hit with a diagnosis of cancer, there isn't the final end where you know you're going to have the baby and then you'll get back to normal, which you never do, of course, because it's a new normal. So I think we need to talk to cancer patients prior to, for instance, talk about if they have difficulties already in their marriage. Let's get you into marriage and family therapy so that those things are cleaned up, and talk about their intimate life right from the get-go. Then give them the tools, get them self-pleasuring. If you've never, I mean, I deal with quite a few people, particularly women, who, for a variety of reasons, have never masturbated, never self-pleasured. And really, for going forward in a healthy relationship throughout these changes, self-care is vital. And so not only for the patient, for the cancer patient themselves, but also giving permission to their partners that to recognize that they may be feeling tired, but their partner is still healthy and horny, and how to respect both needs. So I'll get to that again, later down the road. Down in a few minutes. But working on your mind is vital, and owning sexuality, that it's a vital part of your life, is another big one. And let's talk about the elephant in the room. This beautiful, great big elephant blends in totally with the wallpaper. And you can sit in a room often with healthy married couples, and they don't talk about sex ever. They have it in the dark. They have these euphemisms for wanting it, and or even more subtle inferences for not having it. And so having a conversation where you actually put on the table that the way you're going to get through this is in a healthy way, is to really honor your relationship. There's a beautiful quote here from Dean Ornish, and he says, "The healing power of intimacy. I am not aware of any other factor in medicine, not diet, not smoking, not stress, not genetics, not drugs, not surgery, that has a greater impact on the quality of our lives. Incidents of illness and premature death from all causes. The healing power of intimacy." Johns Hopkins University did a study a few years ago on their cardiac patients, their recovery in after cardiac events. And it proved that those people who were partnered, going through their recovery with a partner, survived and were much stronger and did so much better in rehabilitation than those going through it alone. So it doesn't mean that you have to have a sex partner, but we really do need to focus on having intimate partners, people that will surround us and help us, because we have to be touched. We have to be loved and held and be able to ask for that. Because I think illness is something that can divide us and put us into a very isolated place. And so I wanted to talk about, remember I was talking to 13-year-olds and 14, 15, 16, that age group are all into their bodies. We all are. But as we get older, we kind of, we take a battering in our bodies once you've had several children and age and all the rest of it. But very young people are horrified that somebody's going to take their breasts or make, the changes that goes on from what we do to them. So I wanted to introduce this beautiful woman, Turia Pitt. And I met her when I was in Australia in 2014, and she was on the cover of Glamour magazine. I'm sure you know of this woman. Well, she was going on a run for a fundraiser for the same medical group that I volunteer with, Interplast, and the fire caught her as she was running uphill. And you know the story, I'm sure, that she was burned over 80% of her body. And her story I found utterly fascinating and brilliant as a representative of how people can recover, survive, and thrive. And it become a part of her life that she thinks she's the luckiest person. We're all so much more than our bodies. She says she's very lucky, the luckiest woman on the planet. And her pictures of herself with her fiance, who was a fireman, coincidentally. And I just did a recent checkup on her that she has had her first child, and a second child is due any time now. So I think it's just marvelous that that when you see this body that she so proudly shows off, and she was on the cover of a Glamour magazine. I think it's a beautiful reflection of human spirit. And then Ellie Mayday is the other young lady that I showed to the younger audience to show how proud she is of her body with its scars and all the rest of it. She's just, she says, whether you're running for a marathon or racing against cancer, it's keep your spirits up and keep being proud of yourself. And I personally think self-pleasuring is one of the most strongly enabling, powerful things we can help people to overcome that shyness or inability to do. And when you're talking to young people, of course, you have to take into consideration religious tenets, because in the Catholic religion, it's a sin still. And for men, greater than murder, because you're wasting seed. So you have to overcome a lot of these, these very deep-seated inhibitions and no things. But I still say, in the face of all of it, I think sexual pleasure and learning about your own body is absolutely vital. And if we can teach that and help people before they have their treatments, all the better. Because now you're very aware of all your turn-ons, your pleasure zones, particularly for women who are having breast cancer surgery and removing everything. Nipples are usually a very sensitive turn on for a lot of women. So it's a very healthy thing to say to somebody, in advance of this, let's start looking for other erogenous zones that will give you some hope that you and your partner, or you by yourself, will be able to discover other parts of you that really, really turn you on. And I give feathers out to everybody that I know that I can pass one on. I make them just a little feather. And if you just take the tiniest feather and run it around your body, or have your partner go on a map quest to see what parts of your body are really sensitive, and then grow to helping them use their tongue in those areas to broaden their idea of lovemaking, and become so familiar with themselves, and then share that knowledge with their partners, all in advance. However, if you're not lucky enough to get that in advance, then this is how I go about helping people grow and develop their intimacy. And so those young women and success stories, I think, are terrific. So you can watch the Paula Abdul Avon video that was made. Her sister had breast cancer, and she did this fundraiser and promotion for breast health. And it's a fabulous video. I just think it's so hot and makes breast examining, self-exam, and boyfriends examining you, and it makes it so much fun and normalizes what used to be. I mean, I don't know, I'm old. I remember when it was such a no-no to talk about breast health on the television, and to talk about touching yourself. To was They sexualize our breasts to the point where it's ludicrous. And so this, I think, is fabulous, because I play it at all my mixed groups, and they just love it. Everybody starts getting into the groove, and it's fun. So I really recommend watching it just for some lightheartedness in the middle of talking about cancer. It's good. So then next thing I talk about is the conspiracy of silence, which is why 20 odd years I'm still talking like, oh, nobody's heard anyone say that before. Really? It's because we have a conspiracy of silence around sexuality, and it's not getting better, really. However, so the conspiracy of silence says that we just can't talk about sex. It's rude, difficulty in communicating, because couples do not talk about sex even in normal life. They fight about it. They'll argue about it. They'll be nasty and snidey about it. They'll be loving and cherishing about it. But to sit down and have a conversation is people coming to me say, yeah, we really get into talking about it when we're with you, but once we leave, we don't. We just can't talk about it. So this is fabulous to have opportunities to just dialogue, and in a setting where people can talk, it gets really fun and sometimes a bit racy. So communication, of course, I'm sure hear that over and over and over again, is that we can talk and say how we feel, share what our fears are, and so you can mutually support each other. A lot of people will say, I'm afraid to touch her because I might hurt her. I'm afraid to make love because I don't know how to touch her now, because they see you so fragile. But like it said in that letter to people, we're stronger than we think, and communicating is this: does this feel good? Would you like it like this? Would you like it like that? And do this before you have surgery. Give massages. Do the things that will help enable you to share your deepest feelings. I know in many, many cases, people have said, I was so terrified, but in fact, we've never had a better marriage. So this is a point where the younger ones would go off and do their own thing. And then I'd say, shall we talk about sex now? And so the older people get to actually dialogue about what's going on for them and where do they need help. The big thing is to be able to not come in saying, I have all the answers. I've got a lot, but I don't know you. So tell me what's going on for you. So that's what I love. And then to give them resources, like how many people go through life. If you're going to live long enough, you will go through menopause. It's diabolical that it's happening at 30. So if we know beforehand, let's start with having one orgasm a week is all I ask. It's not a lot to ask. One orgasm a week. Get your body revved up for the days when you're not going to feel too good, but you remember when you've had a good time with yourself, and then it loosens you up and you might be ready for a really nice making love to your partner or with your partner. So the vaginal dryness, is going to happen. And so let's start right away with massaging. I'm going to introduce in my resources a group of it's a site called A Woman's Touch. They have the best resources for vaginal health and vaginal rehabilitation. And if you follow their directions, you can count on having a healthy vagina in 6 weeks. The only time that I would say I would always give a caveat of people who've had radiation, because I have a lot of colorectal cancer patients, and they run a harder road for sure. But I have had super success with these people who haven't had any treatment or any rehabilitative treatment for years, have eventually, with patience, been able to start. This tiny dilator would be way too big for them. A little pinky finger, my pinky finger's tiny, couldn't get a pinky in. And often the same for vaginas when they haven't had any rehabilitation. The atrophy just closes it down completely. And radiologists say to me, oh, I don't care about sex. I just want to be able to get a speculum in so I can see the cervix. I'm like, yeah, well, tell that to your wife or your girlfriend. So no, I'm not going to be doing it for that reason. I'm going to be doing it for all the reasons. So I would say start using dilators. Now, as I say, radiation, whatever you do won't help the atrophy, the burning, the scarring. However, showing a person that their vulva is a place of pleasure and not always pain gives them time to discover their bodies and begin to relearn, even when they've been damaged from all the treatments. And it starts by using some beautiful moisturizing, not lube, and certainly not KY jelly. I'll tell you in the resources section about the kind of lubrications to use and moisturizers. And you start very, very gently, loving your body back to health with massaging the outer labia and the inner labia. And because they've had so much pain in their genitals and in their body, it's to let them feel that they won't hurt themselves. And so then you just continually do this every day with the moisturizers and very gradually begin to open the labia and start to moisturize the internal introitus, just the outside part of it. Don't put any pressure on it to go in there because it's too tight. But eventually, with even a gloved finger, in case you've got hangnails, anything that's got a sharp little edge to it will catch on this delicate skin, and so tissue rather. And so you just gently, gradually ease open the labia. And I think mentally taking the time to do that over days and days and days, you begin to let go. Just gently, gradually relax the pelvis. And then begin with the tip of your pinky. Even if you think you could go straight in, don't. Because you're doing it as an exploration to test the waters. And once they get to a point, maybe in 2 weeks, or actually I've seen them do it very quickly because they really motivated, I suggest that they begin to enjoy their clitoris again, introduce themselves to the place where they can feel pleasure, so that whole area now is changing from pain to pleasure. And then very gradually, and only do it themselves until they know they own their own body, is to begin to get that finger in a little bit more, a little bit more, a little bit more. Because I really, even though I have all these dilators in every size up to the Mr. Jackhammer, I don't like them because they're medicalized. And I much prefer, I wish I could get somebody to put vibrators on these tiny, tiny ones, so that, because they do have vibrating dilators, but they're huge for some of my patients. They could never use them. And so I'd like them to delicately pleasure their clitoris whilst they're kind of, almost tricking themselves into wanting to do more. So eventually that's what happens, and they kind of just familiarize themselves with their own bodies again. And it's remarkable how that works, and the moisturizing helps to rejuvenate the tissue. And now I'm going to, this is a very, a topic of great debate, which I'm sure is in Australia as well as here, is the use of estrogen for vaginal atrophy in cancer patients. And I've heard enough MDs say that it's a quality of life, not a quantity of days issue. And so only vaginal estrogen, low dosed, and majority of it stays in the vagina. It does not go systemic to a degree that it would make a heck of a bit, any real damage to even people who are highly estrogen sensitive cancers. And using progesterone at the same time helps mood, helps sleep, and balances even the tiny bit of estrogen that may go systemic. So as I say, I know that it's a topic that is highly conflicted with a lot of people, but I think do your research and ask more questions. One person's opinion or one person's even medical opinion is only that. And depending on how much research they've done, you can get 20 people with 20 different opinions. So I say do your homework, be your own advocate, and be responsible for yourself. But there are other things that you can do, like I say, the moisturizing can be very valuable. And if you do it long enough, and then begin to use your vagina, as soon as you begin to feel healthy and you can enjoy intercourse again, there's no doubt about it that put this and this together in a very happy, frequent way, it generates a lot of healthy enzymes in the vagina. And it does, Masters and Johnson said that women in their 50s and 60s, postmenopausal women, had healthy self-lubricating vaginas because they had lots of sex. And so once you become healthy again, that's a really big recommendation. One thing that I was going to read is the intimacy, importance of it, because we talk about sex, and if you only look at the sex part of it, when you're sick and you're on chemo and you really feel horrible, it's like you can't think about it. However, if you talk about the importance of touch and the importance of intimacy for both partners, it's absolutely vital. Sexuality is a very confused area in many people's lives. We confuse intimacy with sexuality and lose out on the closeness, and we limit our relationships for fear that one will automatically lead to the other. That is on the closeness and limit our relationships for fear. I'm sorry. That is, touch and intimacy is repelled in long-term relationships for fear that sex is the only agenda. And this is a sad consequence of past conditioning. Now, this is where, when you are given a diagnosis, if you don't have a strong relationship, this is the time to really take a month or two and focus on building up that relationship for the intimacy part of it, because you're both going to need it. Changing our scripts so that we know how to to welcome what we want and know how to limit what we don't want is an education I hope I can assist you with. For now, know that statistics from John Hospital clearly show that those patients recovering from heart attacks and coronary problems who were in loving relationships recovered through their rehabilitation much faster and had better outcomes by far than those going through it alone. During the Second World War, it was documented that babies left in incubators with little to no human touch failed to thrive and even died. It was such a simple observation and one which was very easily remedied. Today in our neonatal intensive care units, volunteers come in to touch and hold and stroke little preemies to avoid this awful void in their little lives. As children grow in healthy homes, they are always nurtured, loved, stroked, hugged until they reach puberty. Then, again statistically, the touch changes. For boys, it becomes rambunctious play, as in ball games and wrestling, if indeed they have ever experienced soft nurturing touch from their fathers. As for girls, fathers generally stop any form of physical contact, and mothers change their touch to a more impersonal method of embrace. All this signals to our children that now touch is somehow off limits and can then be interpreted as even dangerous, thus ultimately becoming uncomfortable. This confusion becomes evident when young people first experience touch from a love interest. Often, open dialogue is the best parenting skill I can suggest. Loving, respectful, asexual touch from a parent is the best antidote to fear-filled, improper conduct as children grow into their exploratory years. Safe, loving touch is paramount for us as healthy adults to demonstrate to our children. Sitting on the sofa to watch TV is a perfect opportunity to gently stroke your child's back. Running a hand over their heads, combing their hair with a loving touch will calm them and fill their hearts with peace. Try this with your partner. It works for them too. As children move into teen years, this attention from parents establishes a wonderful acknowledgement of good touch and is something they will take easily and transmit in their own lives and personal relationships as they grow. Taking the fear out of touch and establishing loving trust is so badly needed in our fear-filled lives. It is not surprising that adult relationships become so off-kilter when touch becomes so confusing. And so at this point, I want to introduce my book because there's in this, these are actually Masters and Johnsons, so these exercises are very old, but they're tried and true and passed on from a very good friend of mine. And these are sensate focus exercises. So they're asexual. And I use these a lot with people who are married even and have just, they've probably arranged marriages or highly religiously focused marriages, that they're so confused by their sex lives because there's no pleasure in it. It's just fearful. So I get them started on exercises like this, sensate focus. And it really takes all the pressure, the agenda-driven sex out of there. They learn how to touch each other and become familiar with each other through starting with eye gazing. It's one of the most difficult things to do for people. It's so intimate that they can't hold each other's gaze. So, and then hair caressing. Like I say, you can do it to your children and they love it. And so do a lot of people. They love having their hair combed or brushed. And then moving on to a foot caress. If you've never had a foot caress, I can understand why people can orgasm through their toes. It's unbelievable. And face caress. This really opens up a lot of emotions for people who haven't really connected. It's a beautiful exercise. And it moves on to bathing. So now they're naked in the bath, but it's bathing without any sexual attention being given to the sex organs or breasts and genitalia. And particularly, this is a beautiful one for women who have had breast cancer, to have moved through these asexual exercises to come to the bathing exercise is often one of the greatest challenges, because they've spent so much time covering up. And we encourage them to wear nice lingerie and to feel pretty and beautiful. But the great transition back into really open celebration of our bodies is to be exposed, scars and all. And so we go very slowly to this point and don't rush it at all. But when they get to this and they can do it, it's a massive turning point for them. And then moving on to a body caress. This is when things really move into a beautiful place. And still, it's not sexual, but it can, if in the end, it says, if sexual arousal takes place, partners may elect to pleasure each other, enjoy self-pleasure, or simply enjoy the presence of such vital feelings. But penile vaginal intercourse is banned following this caress. As in all others, the object is to find pleasure throughout the total body, both in giving and receiving. So that's a really, when you watch people go through this process, it's very, very beautiful and rewarding. Building trust is fabulous. So on my resources pages, the ones that I want to really focus on are these, the Women's Touch, because all of these brochures and all of these helpful information are on that site. You can download them yourself. I have them in hard copy to take with me to my talks, but you can get them online now yourself. So there's vaginal renewal with all the information you need, and this site provides a wand, a vibrating wand, which is a very small, thin vibrating vibrator that probably is more like the size of this dilator. So you can't use it right away, but the minute you begin to lubricate and loosen up the tissue, you using this vibrator goes in and works around the vagina and helps to stimulate blood flow, and does really help quicken, the speeding time. So also then she gives all the details of the moisturizers that are best used and the ones not to be used. Now, personally, I always used to swear by coconut oil, but that's one that she specifically says not to use now because it kills the lactobacillus in the vagina. So you learn, keep on learning. Pelvic floor health for women. Personal lubricants, it tells you all about which ones are good, which ones are bad, which ones you use where, for hot tubs and stuff like that. Of course, people who've had surgery won't be going any hot tubs for a while. A good sex diet. It explains about libido, and this is one that I love, because when you're just going through so much surgery and all the rest of it, you don't want intercourse, but there's tons of other course things, outer course I call it, and a lot of people love it, and even when they can have sex again, practice other course, because it expands the repertoire. And for women who are multi-orgasmic, it gives them an opportunity to have stimulation in their clitoris, and expands the number of orgasms they can have. And of course, 75% of women can only orgasm through clitoral stimulation, 25% with intercourse. So knowing your own body and knowing what turns you on and what is best for you is vital. The dilators are from Soul Source, these non-vibrating ones, and you can go on the internet. Laura Berman does a vibrating dilator, but like I say, it's pretty thick. Even though it's like Russian dolls, you know, over each other, there are only 3, and they're really quite large. So I say get a vibrator, something small, and use it if you're a clitoral orgasmer. Now, if you haven't orgasmed, this is the time to really practice and find out why you haven't. So we don't call it non-orgasmic or anorgasmia anymore. We say pre-orgasmic, meaning we can all orgasm. We just have to learn how. And a lot of it is learning how to let go. So it's a perfect time for going through something like this to bring all the stops out and become so much healthier. So let's celebrate, look forward with vision and determination. It's all in your head to create. I do Zoom sessions all over the world. So just send me an email you've got all my information, and I'll respond immediately. And yeah, we do Zoom sessions.
Nice. Fran, thanks so much for this presentation. It's been just mind-blowing, and it just makes you realize those fears that we all learnt so well in our childhood, in our formative years. Thanks so much, Fran.
Thank you for the opportunity. You just reminded me something that I didn't mention was painful intercourse, because so many people have such terror and pain, and not necessarily because of cancer treatments, but vaginismus and painful sex is very common. And so I always want to know exactly what's going on for them. And I generally would send them to a pelvic floor specialist and have them see on their biofeedback exactly what's going on. So I do believe in empowerment. It's the most precious thing we can give our patients, is to don't have all the answers, but let them be in charge of discovering what's going on. And then you work as a team to find the answers. And so pelvic floor specialists, very important. So many women think they should have sex with their husbands, even though they're gritting their teeth because they feel it's their duty. When actually, if they could talk about it, husbands generally do not like hurting their wives or their partners. And so getting them to work together to have a much happier sex life, using outer course until we figured out what's going on. Generally, everybody's happy. You know, you can do a blowjob, you can give oral, you can use.
Luckily, I could cut right where you said blowjob. That will be a nice stopping point.
You wouldn't let that one in.
You were getting way too.
I was going to say I went too far there, did I? Stop.
I don't know what words you got up to after blowjob, but
that was about it. I think that's it.
All right.
I do Zoom sessions all over the world. So just send me an email you've got all my information, and I'll respond immediately. And yeah, we do Zoom sessions.
Nice. Fran, thanks so much for this presentation. It's been just mind-blowing, and it just makes you realize those fears that we all learnt so well in our childhood, in our formative years. Thanks so much, Fran.
Thank you for the opportunity.